The EU's vaccine rollout had a slow start, with member states struggling to keep up with one another. On Thursday, EU leaders will discuss the Commission plan for 70% of EU adults to be inoculated by summer. We have asked the Maltese health minister if this target is feasible.
I think the realistic targets are that by the end of March, we will have vaccinated all our medical staff and people over 8 years. And I say this should be the target across Europe. By the end of May, we should have vaccinated everybody over 70 and those with chronic illnesses, so all vulnerable groups within our society. And the realistic but ambitious target is that by the end of September, we will have vaccinated 70% of our population, which means herd immunity.
The EU has been criticized for being slow in rolling out the vaccination campaign. Do you think that the EU should have acted faster, like the US, the UK, or Israel?
No, I don't think so. I think we have managed to bring this as a group. Malta, as a small country, we've always been pushing, certainly for the last 6 or 7 years, we've been pushing to try and get joint procurement as a bloc in place. There are different advantages. The first advantage is, of course, that when we negotiate as a bloc with the pharmaceutical industry, then we have much stronger negotiating power than if we negotiate as separate authorities or separate member states. But even more than that, it's price transparency. By procuring together, then we manage to keep the prices down.
Malta is well known for being a top holiday destination, and its economy is really reliant on tourism. Do you think we need vaccination certificates in order to boost, relaunch the tourism industry, but also to facilitate international travels?
It's just another tool that will enable countries to open up further. So there are already citizens who live in green countries, so-called green countries, where travel is unrestricted. And then there are citizens who are in red zones or in red countries. Vaccination certificates for these instances, for the red zones, will enable these citizens to travel even though their community has a high level of the virus. We now need to make sure that we are all vaccinating similarly so we can reach the targets that I've already mentioned, March, May, and September, different targets together. This will enable us to open up our economies as a bloc, which will enable tourism and trade to happen at a faster and to recover at a faster rate.